Welcome to the third of our three-part special series focused on obesity. This special edition of Diabetes Day by Day is a collaborative project of the American Diabetes Association and the American Academy of Family Physicians and is sponsored by Novo Nordisk and Lilly. Obesity is a critical and common health issue. On our first podcast of this special series, we talked about how obesity has increased over the last 50 years. We discussed the consequences of obesity, which are quite serious. And we talked about the change in our understanding of obesity from the old opinion that it was due to a failure of will to our current recognition that obesity is a chronic disease. In the second podcast, we discussed all aspects of treatment of obesity. Today, we're going to talk about how to talk to your doctor and how to organize your visit when you want to address obesity so that the visit is as useful as possible. The truth is, often we go to the doctor's office and we don't think about how we're going to prepare for it, what we're going to say. Today, we're going to talk about that so we have an optimal visit when it comes to obesity, because we think that's useful, and we're going to give you some concrete advice how to do that. I'm Dr. Neil Skolnik, Professor of Family and Community Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University, and joining me as always is my co-host.
Thanks, Neil. I'm excited for this episode. I'm Dr. Sara Wettergreen, an assistant professor at the University of Colorado Skaggs School of Pharmacy and an ambulatory care clinical pharmacist.
And we have two guests joining us today. Tamika Holland, who is an elementary school administrator and a person who has obesity. Welcome, Tamika.
Thank you. I'm so happy to be here today.
Also joining us is Aaron Sutton, a licensed clinical social worker and behavioral health specialist. Aaron is Chief Wellness Officer for Graduate Medical Education at Jefferson Health Abington and an Adjunct Clinical Assistant Professor of Family and Community Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University. Welcome, Aaron.
Thank you so much, Dr. Skolnik. It's a pleasure to be here.
Tamika, let's start with you. What do you see as some of the most important challenges in discussing obesity with your doctor, nurse practitioner, or PA?
That's a good question, Neil. I think one of the most important challenges is feeling comfortable and trusting your provider. It's really important that you feel like you're going to be heard, like you're going to get a helpful response. And having that comfort can be tricky, especially if you're only seeing them for your physical or every now and again when you come in. But especially if you're getting a short answer that kind of shuts down the conversation, it's hard to feel comfortable.
Yeah, I think it's so important. And trust is something that, in many ways, family medicine, primary care, we're ideally suited for that because trust often develops over time by repeatedly seeing someone, and you establish trust, right? We know that. But it's great when you can have a family doctor that is your family doctor who is you feel comfortable with, who you trust. As we're thinking about the main topic that we're talking about today, which is how to optimize that visit when we go to the doctor, really it starts with choosing your doctor. And your point is such a good one, Tamika. It's about trust and comfort. And there's nothing like asking friends for recommendations. Or if you're new to a town, looking carefully at online reviews, paying attention to what's said about how that doctor interacts with patients. Because if you choose the right clinician, then it is overwhelmingly likely that you're going to have a good experience. Aaron, any thoughts you have?
I think Tamika brings up a really good point, Neil, in talking about comfort. I think lots of times for lots of people, we only see our primary care physicians either for annual visits or for sick visits. So it's very infrequently that we see them. So we feel as if when we're there, we have to discuss the topic that we're there for. And I think these visits really need to be a longer visit specifically for those conversations. I think also it's okay to talk to your doctor about the frequency of visits. I think lots of times the physician thinks, well, you may not need to come back for 6 months or a year, but in your mind, you would like to come back and say 2 to 3 months to discuss some of these things that you want to work on. So making sure you're on the same page. And I think to address Tamika's second concern, talking about the ability to open up, I think having those more frequent visits will allow you to engage with your provider and really have a deeper relationship with them so you feel more comfortable in sharing.
Aaron, your point is a good one. Often from a patient's point of view, that annual visit is that opportunity to take care of everything. But if we think about obesity, it has become one of the most complicated things that we treat, and something where the understanding of the underlying physiology, the causes, the treatments of obesity have changed so much in the last few years that we may be better off saying during that annual physical, you know what? I'd like to discuss management of my weight, but I realize that it's a complicated topic. Can we set up a visit just to discuss that? Sara, your thoughts?
It definitely has. And what I think is challenging too for being a member of the care team is understanding when it's the time to have that conversation. And I love your point there, Aaron, of having that specific visit. I'm recalling a conversation I had with a patient I was speaking with today who brought up their discomfort with their weight, but it wasn't what we were talking about that day. And you just feel this hesitation of, do we want to dive into it, even if I have time? Will this make them feel worse about this subject? Will it make them feel better about this subject to dive into it further? And so having that specific visit and conversation and that designation from a patient to say, hey, I'm here to talk about my weight, and this is what I want to focus on today, I think just brings so much clarity to the conversation and just puts us all on the same page to know we both want to talk about this subject for the day. Because Neil, I imagine from your practice, sometimes this feels like a subject that can be difficult to bring up from the provider standpoint, just as much as it might be from the patient side.
Sara, that's such a good point. In a way, we're uncovering for our listeners today a little bit about what's behind the curtain. We know that as patients, we're a little bit anxious when we go to see the doctor. What are the questions we should ask? Will we remember everything we intended to ask? What we don't realize is that doctors also are concerned, particularly when it comes to weight management. Is a patient going to be insulted if I bring up the topic? How should I bring that up? That's really one of the benefits of, as a patient, being able to say, hey, I would like to talk about weight management. Should we discuss that today, or should I set up a separate visit to talk about it so that we have more time to delve into it? Aaron, your thoughts about that idea of planning a visit to talk about important things?
Neil, I think that's an excellent point. I think for certain it's better to have an appointment focused just on weight loss for 2 reasons. One, I think it greatly benefits the provider. We're talking about a patient's point of view, but let's turn the tables, as you said, look behind the curtain for a moment. Providers love to go into a room knowing what we're going to be talking about. It gives us ample time to prepare any responses to questions that may come up. Questions such as, what should my ideal weight loss be? And what happens if I gain weight back? That way, it gives us a fighting chance to come in with answers before the visit even begins. And for the patient, as we talked about anxiety, we are going to feel anxious. This is going to be an anxiety-provoking visit. And unlike other visits, such as an annual visit or a visit if you're sick, we're going to go in with questions this time, questions that we want answered. And it gives us that opportunity to think about, again, questions such as, how much weight should I lose? And are there different medications that are better for me than others? Should I think about a procedure? Is this something I should be working on before I start to take a medication? So I think it's great to have this visit set up for both not only the patient, but physicians, nurse practitioners, and PAs as well.
Now, you've asked your doctor that you want to put a visit aside to talk about your weight. How do you approach that visit? Aaron, any thoughts about how patients might prepare for that visit?
Thanks, Neil. It's a really good question, because I think that, again, as Tamika was saying, you have to be comfortable in disclosing what you have done about your weight. This is not a new topic, right? This is something you've been thinking about enough to bring it to a doctor's visit. And I want to make sure that people are really honest and give a detailed past history of what they've done for diet and exercise. Sometimes they can have limitations. They can have physical limitations of workouts that they can or cannot do. They may have certain dietary preferences or restrictions as well. And I think if we look at this as a one size fits all, it doesn't. I think we know that, Neil, where people are going to bring in what they've done, and we want to make sure that we're not giving them the same advice for things they've already tried. So making sure you bring that information to the table so that can be addressed. I think also, are there any other professionals that people are working with, right? People like a trainer or a registered dietitian, a psychotherapist, perhaps. So we can all be on the same page and having this combined treatment plan that we can all be a part of.
It's honesty is very interesting, and I think it's so important. I will never forget a patient who taught me a lot about listening and about how different we all are, because I was talking about the importance of exercise. And after I finally stopped talking, she shared with me how, one, the idea of exercise is awful because gym in class growing up was the worst experience of her whole life. And the idea of going to any place like one of the large, big gyms out there to go work out, she felt that people were looking at her and would be quietly making fun of her. And so that, Aaron, when you talk about honesty, I think if we don't share what our constraints are, what our concerns are, it's hard to expect our doctor to be able to give us advice that's appropriate for us. When I think about how to prepare for visits, I think patients sometimes forget that we are trying to do our best. As family doctors, nurse practitioners, PAs, I'm just going to use the term doctor to apply to all of us. We are trying to do our best. And at the same time, we are usually running 2 or 3 patients behind. You know this. And we don't like keeping people waiting. And so we try and get through the visit in a effective, but also an efficient manner. So that's why if you know this and are able to put aside a visit where you can talk about that issue that's important to you, obesity, you'll find that you have a physician who can devote their full attention and time to that one issue, and it allows us to give you what we both want, which is the time to delve into depth into a topic that is complicated, is very personal, and often requires that time to talk through all the different components of both history and treatment. Having that time available also allows us to educate about obesity, because there is a lot of education that is important. We've talked on our other podcasts how obesity is a combination of hormonal changes that then resist weight loss when you lose weight. And most of us had this experience. When you lose weight, you lose it for a little while and then you regain it. And it gives me the opportunity to talk about all those complicated things like metabolic adaptation and hormonal changes that resist weight loss. And I've seen patients have this aha moment when we have the time to talk about that, or a number of patients who cry because they realize it's not their fault. They have a disease called obesity. And so when you as a patient say, let's put aside time for a full visit about obesity, you get that visit that you are looking forward to. Sara?
I completely agree. And I think the other important piece of this to remember too is to think about when you're preparing for the visit, understanding what your goals are. Thinking we might have the evidence that says from the scientific side how much weight we think is recommended in terms of weight loss and what the targets might be. But I feel like there are so many patients that I talk to who don't feel like themselves if they are above or even below a certain weight. And so is there an ideal weight that you have in your mind? And can we talk about that number together to see how that might line up with evidence? Tamika, I'd love to hear your perspective on how you, from the patient perspective, might prepare for a visit.
I think it's so tough, like we said, building the comfort and the trust. And then when you finally get to the doctor, I feel like I came with a good bit of background knowledge. And I think, like Neil was saying, it did get to a point where I was like, I know all of these things, they're just not working, and it's not for lack of trying. But then finally getting there, and I laid it all out. And I don't know that I would have done that with a provider that I didn't feel that would listen and would trust me, or that I would trust rather. But I gave a lot of that background of I've tried X, Y, and Z. I do like to work out, what I do, the diet, different habits. But I think getting to that point, I'm going to bring the struggle up. It was post COVID. I think everyone probably gained some weight for not being as active, but I got to a really low point emotionally.
Tamika, hearing you talk really underscores the importance of having a dedicated visit for obesity. There's so much to go over. There's what you've done in the past. And as you now brought up, more than most other things we take care of, there's a tie between obesity, weight management, and emotion. And that takes time to talk about. It takes time to unravel. And as a patient, if we can ask for a dedicated visit, that gives our doctor and us the time to talk about this interweave between emotion and weight management and meaning. Aaron, your thoughts?
Absolutely. I think that that is such an important topic that probably isn't talked about as much is the emotional impact of gaining weight and then losing weight. For instance, most bariatric centers have a psychological evaluation before you lose weight that looks at how your mood has been in regards to gaining weight, but also to plan for what is going to happen when you lose a significant amount of weight. I think that oftentimes we hear about people's moods feeling down when they have gained weight, feelings of hopelessness that I'm never going to be able to lose this weight. But then rarely do we actually talk about what happens after weight loss. Again, we can have those same feelings of feeling down that I am not able to do this on my own, or more often than not, feelings of anxiety that I'm going to actually gain this weight back. And Neil, you're talking about different methods of losing weight, things such as medication, diet, and lifestyle changes. And I think it's important to really talk to our patients about if we're going to start a medication, then making sure that we're having those dedicated follow ups to look at how your emotional state is while you're in this process. This is going to be a new life for you, and we want to make this a productive life that is full of joy. And so, again, partnering together, saying, I'll be with you on this journey. Not only do I want to look at your weight loss, but I want to look at how your emotional state as well. I think that's really going to be a double impact for patients and providers.
Those are great points, Aaron. And so we really begin to see how we as a patient have immense power in constructing the visit to meet our needs, whether those needs are emotional, informational, pharmacologic, to the degree that we can think ahead and say, how do we want that visit structured? What's the information that we can go in with, perhaps? It is helpful if people can look up and have some idea about the range of options and what their opinion is about some of those options, and utilize that doctor's visit to learn more about that. So, for instance, we have diet and exercise, we have medicines, we have bariatric surgery. We make best use of the time if we might, for instance, with diet and exercise, say, well, I've already done that to best of my ability. I'm looking for advice on other options now. Or if you have looked up the options and you really would like to hear more about bariatric surgery, that helps the doctor direct the visit in a manner that meets your needs best. If you've done diet and exercise to the best of your ability, it might not be the best use of either your time or the doctor's time for the doctor to go into detail about how to approach that. Or if you feel that you need to learn more about that, then what an important thing to let the doctor know that that's what you like to learn more about. So, Aaron, I think to the degree that a patient can prepare for that visit and help direct the doctor to what is the most important thing that you'd like to talk about, that only serves everyone's purpose well. And to the degree that you can help the clinician organize that visit around your needs, it helps you get the most out of the visit.
I think that's fantastic. I think there's just so many different things to know, where I also want to say, if you don't have that level of preparation and your mind is not in a place to research all that, it's also okay if you show up and you ask questions. It might just take more than one visit to get more progress toward the solution that will be ideal for you and your care, so you can continue to learn along the way. I think the more that you are empowered to do your own research and find that information and have at least some background to talk about options, whether it be medications or other approaches, I think is certainly so helpful. Now, one of the challenges we know exists, Neil, is insurance coverage. And that definitely has to be part of the conversation, because if you're most interested in a specific option and it's not something that's covered by your insurance, that could certainly be a problem.
Yeah, and I'll tell you, that is one of the things in preparation that's incredibly helpful. If patients can check with their insurance company first, because if you're interested in a weight loss medicine, one medicine may be covered, another might not be, none may be covered, or the copay may be higher than you can afford. And one of the just most difficult things is when you spend a whole visit talking about a particular medicine, and then we don't find out until a few days later that it's not covered. And there's no way for most of us in primary care to keep up with the changes of insurance, because it's not even does this insurance or that insurance cover it. It actually is a type of coverage that is opted into or not by your particular employer. So 3 different people might have, say, Blue Cross. Only one might be covered, another covered as a second tier medicine with a higher copay, etc. And I really encourage patients to look that up so that we talk about the things that are most relevant and possible. Sarah?
I agree. I would say it's not the end of the road, though, if you feel like you get to that point and you find out that it is not covered by your insurance. If there are some coverage challenges, or maybe the copay is high, some companies have weight loss medication saving cards that can help bring down the price of the copay. So at the time of this recording, both Wegovy and Zepbound have those saving cards available that can play a significant role. Even if you're not able to use it forever, it'll something to help you get started and see if this is a good option in case that coverage does change. The other thing to think about is that if you're not able to access these weight loss medications due to insurance coverage, like Neil said, for commercial insurance plans, this is something that the employers opt into. And so you can have a conversation with your employer's human resources department about the importance that this medication might have for you, to see if this could be changed in the future. There are some letter templates available online if you need some support in that, or it could be something that even you bring to your care provider to see if they can help you, and having some background to support this conversation. So hopefully, even if it is not covered at the time when you first ask, hopefully that's not the end of the conversation and there are steps that can move things forward.
It's interesting, Sarah. As you say that, it occurs to me the coverage of weight loss medicines has improved remarkably over the last 12 to 18 months. I think we've
Exactly.
both
Yeah.
noticed a difference. So I think those things you're suggesting, sometimes we feel like we're up against the whole world. They actually make a difference. Employers are recognizing that these are medicines that are important to people.
And I think as a patient, it's so important to know that a no from an insurance or cost standpoint right now doesn't mean a no forever. It could just be a temporary challenge. Tamika, I'd love to hear your thoughts.
Yeah, no, I think that's a really big point. I have a cost savings card right now for my medicine. So I haven't paid for it for quite some time, which is lovely. But most recently, we did have our prescription insurance changed for our school district. And that was a little tough, especially because it was covered for so long. But thankfully, their pharmacist talked to my doctor, and it did take a little bit of work, but we were able to make sure it was covered. So sometimes it is just asking questions, a little bit of work from your provider, but it can really help. Yeah, Sarah.
Important point of the conversation, Tamika, is to recognize that when those challenges come up, different challenges might happen with these medications, whether it's prior authorizations or changing your insurance plan and going through different processes or supply issues. Just knowing as a patient that your care team from your primary care team or other resources is there to help guide you through it. One that we definitely have seen prevalence of in the last year in particular is supply issues. Neil, can you share a little bit more light on that?
Yeah, this has been a tough issue. And I know that the companies that make the weight loss drugs certainly are doing their best to keep the supply up. And because of how important these medicines are, we really do now in medicine think about obesity as the way to address many of the downstream effects of obesity. We talked a little bit about this on our last podcast, that adiposity is the medical term, in turn causes things like high blood pressure, diabetes, fatty liver, downstream effects like heart disease. So we really more and more have recognized the importance, and because of that recognition, the medicines have become very popular. And therefore, there are supply issues. The companies are working on it. This will correct itself. The companies will correct it. And so it might be a little while. In the meantime, I think it's the perfect time to say, let me get down those habits. Let me talk to my doctor, my behaviorist, enlist a personal trainer, a dietitian, if you can. Let me get down those lifestyle habits, which the medicines help you, but don't expect them to do it all for you. If you want to have optimal health, you want to eat right, you want to exercise, and many of us need medicines as well, this is the time to get those habits of exercise. Aaron?
Yeah, I think, Neil, you bring up a really good point that the medications will help, but this is also going to be, like I said earlier, a lifestyle change. So you're really going to have to incorporate a different way of living. And this is going to be a long-term game. So really have those practices in place. Like you said, this is an optimum time now to have that plan in place when the medication comes in.
Tamika?
Yeah, I think that's definitely a huge learning piece with this. I'm fortunate enough to have the behavior specialist, the personal trainer, the nutritionist, and being on medication. And I think it's made a really big difference. I think one of my fears that kind of lives in the back of my head is I'm going to gain all of this weight back and what's going to happen. But through getting those habits down, life has happened, right? Huge things have come up, and figuring out how you eat when there's a busy week, all of the things that seem like small nuances have really become something for me to work out and make a regular regimen. And I think it's really important. Sarah?
Something we keep coming back to, and that you highlighted really well, Tamika, is these support services, that it's not just one patient working with one provider. Having that support system, I think, can be so useful in feeling the different challenges that through your journey, feeling supported through those and overcoming those barriers as they come up. Because we know, like anything, weight is something where you head in one direction for a while, maybe switch back, and those ebbs and flows can happen, especially when we think about things like lifestyle changes. So when I think about that, it makes me wonder, and I'd love your insight, Neil, as a primary care physician, do you feel like this is something that is treated well in a primary care office? Is it something you need to see a specialist for? I think it might depend, but I'd love your thoughts.
That's a critically important question, Sarah. And I think you're right. It depends both on the individual patient and on their physician. So that as we talked about earlier, there are very few areas which have changed as much as obesity in terms of our understanding of it as a chronic disease over the last 10 years and medicines available to treat it. Because of that, there are some doctors that really have kept up and are right on top of obesity and really enjoy treating it. It's very common. I think that's true of most family doctors, but there are also people who say this is new. I'm not sure I'm up to speed yet on it. I think it's never a problem as a patient, whether we're talking about obesity or diabetes or hypertension or anything, for you to say to your doctor, let me ask you a question. Are you the best person to talk to about this? I think we're honest. We're here to help. And I would happily say, yes, I am. I will take good care of you. But there are areas where a patient will ask me, and I'll say, this isn't something I do a lot. One of my colleagues is great at injecting shoulders for people with different types of shoulder conditions. If I have a patient come to me with a hurt shoulder, I say, you know what? I'm going to ask you to see Dr. So-and-so because they're really good at this. Tamika?
Yeah, I think that honesty, trust, and the comfort level. That's probably one of the reasons why I rave about my primary doctor so much, because that visit where I was finally ready to bring it up, he very honestly said he didn't have much experience with it, but I can refer you to, and he named a bariatric doctor, which for me, I'll be honest, I thought they only did surgery. So that was jarring. I definitely learned something that day, but it's great. That honesty and being able to point me in the right direction made all the difference. And I'm so happy.
So important. I want to shift gears now. Sara, it occurs to me we've talked a lot about in-person medical visits in the office, but we live in a changing world. Any thoughts about online care and telehealth?
Neil, that's a great point. We know healthcare is evolving and that there are more and more telehealth options. And thinking about all these options, something that we often talk about on this podcast is the importance of self-advocacy. And I think that's something that really comes into play here. Thinking about all these options, knowing these options exist for care delivery, but also having the autonomy to make choices that are best for you, I find is so important. Going specifically into care delivery and those visits, there are certainly options to have your office visits online. Your own primary care office might offer telehealth visits online. And I think that's a great option when it's someone you already have that relationship with. We've talked a lot about trust today and how important that can be. But maybe you're someone who doesn't have that consistency, or it's someone that you haven't seen as regularly, or you're just looking for a very specific focused visit with a specialist in one area, like for weight loss. And so there may be other options available for telehealth approaches to access care where you can get these visits consistently and regularly with someone new. So I think it's great to have options. The other place I think about these options is with medication delivery. Of course, as a pharmacist, that's the lens that I'm thinking of. And when I think about there being lots of options, the thing that comes to mind for me is accessibility. And that's something that, as a member of the healthcare team, we all want for our patients. When looking at medications, I think a lot of people probably think about picking up medications from their local pharmacy. And I think that's a fantastic option for many people. But there are also reasons you might not feel that's the most accessible option. I have some patients I work with who live over 30 miles from a local pharmacy. I have other people I talk to who have transportation issues, and it's very difficult for them to get there. And so when I think about the choices, other options are probably going to be better for those individuals. And I think it's wonderful that people can have the option to find this pathway that'll be best for them, whether it be mail delivery pharmacies or other programs available that help patients access medications directly from pharmaceutical companies, for example. Coming back to your point, Tamika, I think when I look at all these options, telehealth, telepharmacy, all these choices, it's really about your comfort level as a patient and finding what works for you.
That's so important. Now, the weight loss medicines often require a team approach. Sara, can you say a few words about where the pharmacist fits into the team care?
Absolutely. I think there's so many places a pharmacist can play a role. So in my own role as a pharmacist in a primary care practice, it could be helping to titrate the medication. So having those phone call follow-ups or telehealth visits, or even in person to talk about what's your experience been with this medication so far? Are you experiencing any side effects? And as we've talked about in the last episode, if you have those side effects, what can we do to help triage or manage them? The other area I think pharmacists can have a significant role is in access to the medications. If you're having trouble getting it from your pharmacy, or there's a supply issue or a cost barrier, a pharmacist is someone who can help you to first figure out what the challenge is and then figure out ways to help overcome that, whether it be solutions we've talked about already today, things like copay cards or those manufacturer discount cards, but also thinking about that the prior authorization system can be complex. Is there other information that's needed or other documentation? So I think just having multiple members part of your care team and having that medication expert when we're focused so much on a medication certainly can be of benefit.
So important. We only have a few minutes left. Aaron, any final thoughts for our listeners?
Neil, this is such a rapidly changing landscape. And I think you had mentioned that earlier, just how over the last several months this has changed. And I hope that people feel optimistic now about these changes. And this has been such a great conversation that we've had, especially with Tamika giving insight into about how to feel comfortable in having this conversation, because there are lots of options now. And I hope that our listeners today gained that optimism that there are some new approaches and that people can really benefit from this.
Tamika, your final thoughts.
I think this has come up, but two things I think of is definitely to do your own research. I know it can be tough, or if there are feelings of overwhelm, but I think, and that can look a couple of different ways, right? Looking on trusted websites. But I think one thing that has been helpful for me is just talking to other people that have been in the situation, or I've had a few friends come to me. So having some different thoughts and perspectives in mind are helpful. And the other thing, it's those relationships and that trust and that great care I get. I think it's good to make sure you have a provider that you feel comfortable with.
Fantastic. Sara, your thoughts.
I think this has been a fantastic, insightful conversation. My final thought is really just to start the conversation with your care team member, whether that be in your primary care visit, your specific appointment, or even with family and friends, just to start opening your mind to getting more comfortable and thinking about this subject. You might be surprised about how much information is already out there and that you can gain from working with others.
Tamika Holland, thank you so much for joining us.
Thank you. It's been such a pleasure. I really appreciate it.
Aaron Sutton, thank you.
Always a pleasure, Neil.
And Sara, as always, as my co-host, it is always a pleasure working with you.
Happy to be here.
And most importantly, I want to thank our listeners. We've covered a lot of ground today. We've talked about the importance of having a doctor that you trust, scheduling a specific visit so that you have the time to discuss all the complexities of obesity care, talking in an honest way so that your doctor knows what you've already tried, thinking a little bit and maybe even researching the different options so that you can share with your doctor what your goals are. And as Sara talked about, enlist that team approach. Ask your doctor, would it be helpful to have a pharmacist involved? How about a dietitian, a personal trainer, or treatment determined with us as a partner and the ability to move consistently forward. Again, I want to thank everybody for joining us on the third of this three-part series on obesity, which is a collaborative project of the American Diabetes Association and the American Academy of Family Physicians, and is sponsored by Novo Nordisk and Lilly. If you have thoughts or comments that you would like to share with us or share with the audience, just leave us a message at 703-755-7288. We'd love to hear from you. For the American Diabetes Association and the American Academy of Family Physicians, I'm Dr. Neil Skolnik. Have a good rest of your day.